Right, beta. So now talk about the oligodendroglioma. It's another glial cell tumor. It's a glioma. It's an infiltrating glioma. It infiltrates into the brain tissue diffusely, right? Obviously composed of the cells which resemble the oligodendrocytes. And this oligodendroglioma, it makes up 5 to 15% of all the glial tumors, all the gliomas. Loves to appear in the age between 4th to 5th decade, ठीक है, यानी कि 40 से 60 साल की उम्र जो है उसमें ये अपीयर होता है। इन्फिल्ट्रेटिंग ग्लायोमा है। मेन जो कंप्लेन होते हैं बेटा वो होती है सेवरल ईयर्स ऑफ द न्यूरोलॉजिक कंप्लेंट, और उसमें भी खास करके सीजर्स। एक बहुत वक्त से एक ही कंप्लेन है पेशेंट को, सीजर्स की। तो कितनी बातें कर ली, एक तो हमने देख लिया कि ये कितने परसेंट है। इट मेक्स अप द 5 to 15% ऑफ द ऑल द ग्लायोमास, ओलिगोडेंड्रोग्लियोमा। एज ग्रुप देख लिया हमने, ठीक है। कंपोजिशन में सेल्स रिजेंबलिंग द ओलिगोडेंड्रोसाइट्स, और मेन प्रेजेंटिंग कंप्लेंट जो होती है वो सीजर्स होती है बड़े अरसे से लेके। साइट की बात करें बेटा तो ये सेरिब्रल हेमीस्फीयर्स विद प्रीडेलिकेशन ऑफ द वाइट मैटर. We will better study this thing and we'll be talking about the morphology, but for now you just keep in your mind that the oligodendroglioma, it's a glial tumor composed of the cells resembling the oligodendrocytes and arise from the cerebral hemisphere. What are the underlying mutations that are responsible for the development of this bad boy, oligodendroglioma? So let's talk about it. The molecular alterations, just a second. Okay, so yeah, the molecular alterations behind this include, let me show you. The mutations involve are, number 1, isolated dehydrogenase enzyme का जो जीन होता है बेटा 1 or 2, right? So if there is the mutation in this gene, it will lead to the development of the oligodendroglioma. And this is the mutation responsible for 90% of the oligodendroglioma. That's a big percentage, and even it shows the better prognosis, right? Particularly the type 2 mutations, IDH2. ठीक है बेटा, इसके अलावा कौन सी mutations may be responsible for this oligodendroglioma? Number 2 is the deletions of particular portion of chromosome 1p and chromosome 19q as a core deletion. core deletion होती है chromosome 1 पे भी होती है और क्रोमोसोम 19 पे भी होती है, ठीक है। तो 2 म्यूटेशंस अभी तक मैंने बता चुका हूँ बेटा आपको, एक IDH1 IDH2 में, दूसरा डिलीशंस कहाँ पे, क्रोमोसोम 1 पे और क्रोमोसोम 19 पे, ठीक है। कोर डिलीशंस होती हैं, दोनों साथ में होती हैं। उसके अलावा व्हाट म्यूटेशंस बेटा, additional genetic alterations include loss of the chromosome 9p, loss of chromosome 10q and the mutations in the cyclin dependent kinase 2a, ठीक है बेटा। इस तरीके से EGFR एम्प्लीफिकेशन नहीं मिलती इसके अंदर, अनलाइक द हाई ग्रेड एस्ट्रोसिटिक ट्यूमर्स। हाई ग्रेड एस्ट्रोसिटिक ट्यूमर्स में तो EGFR एम्प्लीफिकेशन मिलती है, लेकिन इसकी कुछ वैरायटीज़ हैं जो कि शो करती हैं इंक्रीज लेवल्स ऑफ EGFR, बट देयर इज़ एक्चुअली नो EGFR म्यूटेशन। सो इफ़ आई समराइज दिस पोर्शन फॉर यू, देन आई मस्ट से कि कौन सी म्यूटेशन बेटा, क्विकली रिकैप करें मेरे साथ। IDH1 IDH2 ये सबसे कॉमन म्यूटेशन है इसके अंदर, ओलिगोडेंड्रोग्लियोमा के अंदर। इसके अलावा नंबर 2 पे क्या बताया था, डिलीशंस किसके अंदर, कौन से क्रोमोसोम में, 1 और क्रोमोसोम 19 में, ठीक हो गया जी। चलें, इसके अलावा एडिशनल म्यूटेशंस मैंने आपको बताया था, लॉस ऑफ 9p, लॉस ऑफ 10q, उसके अलावा साइक्लिन डिपेंडेंट काइनेस 2a की म्यूटेशंस, ठीक है। EGFR की म्यूटेशंस अमूमन ओलिगोडेंड्रोग्लियोमा में नहीं मिलती, लेकिन समटाइम्स यू कम टू सी कि EGFR प्रोटीन के लेवल्स एलिवेटेड हैं ओलिगोडेंड्रोग्लियोमा में, ठीक है। If the oligodendroglioma is due to these mutations, deletions of 1p and 19q, then this tumor responds to chemotherapy and radiotherapy very much effectively. Very radiosensitive, very chemosensitive. So if I develop the oligodendroglioma and the underlying mutation is the deletion of 1p 19q core deletion, then the tumor is very much chemosensitive. You just provide the tumor with chemo and radio, it will be treated, right, responding very well. Without this mutation, without the loss of 1PR19Q, the tumor is resistant to chemo in other cases. I hope you understand what I'm trying to say. If I take you to the morphology part of this tumor, just a second. The morphology part of this tumor, which tumor? Oligodendroglioma. So let's see the gross appearance and the microscopy. Grossly, this tumor is very well circumscribed, gelatinous gray masses with the cysts and the focal hemorrhage and the calcifications. So actually what I'm trying to say beta here is the tumor is very well circumscribed, just like your pilocytic astrocytoma. It's gelatinous gray mass with cyst and areas of hemorrhage and areas of calcification, right? And the tumor is composed of obviously tumor cells. The tumor cells, there is actually the sheet of the regular cells. Tumor cells की बात करें, there is a sheet just like this, is sheet of the regular cells. इस तरीके से एक ये sheet हो गई, एक ये sheet हो गई. This is sheet of the regular cells. If you take one cell out, and in that cell you will see the nucleus present inside the cell is very much spherical, and inside that spherical nucleus the chromatin present is very much granular chromatin, right? And the cytoplasm is surrounded by the clear cytoplasmic, the vacuolated cytoplasm, right? Yeah, जो cytoplasmic halo होता है ना, clear halo around the nucleus. Okay, so far what did I say? It's a well demarcated tumor, really good looking, as a gray mass, areas of the hemorrhage, areas of calcification. The tumor cells are arranged in the form of the regular sheets की form में arrange होते हैं. If you take one tumor cell out, and in that tumor cell you will see this is the cell membrane of the tumor cell. This is the nucleus. The nucleus is very much spherical nucleus. Inside this inside is the nucleus, and the nucleus is very much spherical. Inside the nucleus there is the chromatin material very much granular, and if you see around this nucleus, this clear halo is present. This is nothing but a vacuolated cytoplasm which is present around the nucleus. Right beta, so I hope it is easy, not difficult. Along with the regular sheet of the regular cells, there is also the presence of the anastomosing capillaries inside the tumor, and the calcification is also present in this tumor. Calcification depend करता है, बहुत कम माइक्रोस्कोपिक भी हो सकती है या फिर मैसिव calcification भी हो सकती है, ठीक है. And calcification is seen in 90% of the oligodendrogliomas. No doubt it is microscopic or massive, it is present. Okay. So yeah, क्या क्या कंपोजिशन में आ जाता है ट्यूमर सेल्स इस ओलिगोडेंड्रोग्लियोमा में? एक तो ट्यूमर सेल्स होंगे, जाहिर सी बात है, कैपिलरीज मौजूद हैं, कैल्सिफिकेशन मौजूद है, सही है बच्चों. इस तरीके से ट्यूमर सेल की आपने माइक्रोस्कोपी भी देख ली. इसके अलावा द ट्यूमर सेल्स इन्फिल्ट्रेटिंग द सेरेब्रल कॉर्टेक्स, दे कलेक्ट अराउंड द न्यूरॉन्स, एंड दिस प्रॉपर्टी ऑफ दिस प्रॉपर्टी is said to be the perineuronal satelloidosis. What did I say? The tumor cells which are infiltrating the cerebral cortex, they collect around the neurons. Okay, so this is your oligodendroglioma, very well demarcated. You took this cell out. What is this cell? This is the oligodendrocyte ना, which is actually a glial cell. जब ये cells आगे infiltrate करते हैं तो if this is a neuron, तो न्यूरॉन के अराउंड ये जो सेल्स हैं वो कलेक्ट होना शुरू हो जाते हैं. This is one oligodendrocyte tumor cell, this is another tumor cell, this is another tumor cell. So you can see the oligodendrocytes, the tumor cells are being collected around the neurons. This property is seen in the oligodendroglioma, and it is said to be the perineuronal, around the neuron, satelloidosis, right? It is the infiltrating, or it is the collection of the tumor cells around the neurons in the cerebrum, right? It's easy, my son, it's very easy. What about the mitotic activity of the cells in this tumor? It is minimal or very much absent, and therefore this tumor is very much low grade tumor, the grade 2 variety, WHO grade 2 tumor, right beta? इस तरीके से. So Let's move to the next page, and you see the anaplastic oligodendroglioma. It is actually the oligodendroglioma, but it is a little and it is because it's the name indicates it is anaplastic, so it must be a high grade tumor. On the previous page I told you oligodendroglioma is a glial tumor composed of the oligodendrocytes. Tumor is very much well demarcated. The tumor cells are the oligodendrocytes, and I told you all the story about the cell. And in the end I told you this tumor is very much low grade tumor क्योंकि इसके अंदर माइटोटिक एक्टिविटी काफ़ी कम होती है, and it is classified as the grade 2 tumor. But there is a variety of the oligodendroglioma that is said to be the anaplastic oligodendroglioma. It is not grade 2. It is not grade 2 or low grade tumor. It shows some high grade features. So this type of the oligodendroglioma, which is high grade 3 tumor, it is said to be the anaplastic oligodendroglioma, right? तो इसके अंदर जो फीचर्स होंगे वो जाहिर सी बात है, पहले हमने जो ओलिगोडेंड्रोग्लियोमा डिस्कस किया था ग्रेड 2, वो जाहिर सी बात है उसमें नहीं होंगे. सो व्हाट आर द हिस्टोलॉजिक फीचर्स विच आर प्रेजेंट इन द एनाप्लास्टिक ओलिगोडेंड्रोग्लियोमा विच एक्चुअली मेक द एनाप्लास्टिक ओलिगोडेंड्रोग्लियोमा हाई ग्रेड ट्यूमर? इज द प्रेजेंस ऑफ द हायर सेल डेंसिटी, क्योंकि माइटोसिस ज़्यादा है, साथ में न्यूक्लियर एनाप्लेजिया, न्यूक्लियर एटिपिया, and there is the presence of the necrosis. If these features are present in your oligodendroglioma, it is anaplastic oligodendroglioma, that is the high grade tumor, grade 3. If these features are not present, go to the previous page, it is grade 2 oligodendroglioma, right beta? These tumors are obviously grouped with the glioblastoma. I hope you people remember what is glioblastoma. Glioblastoma is the high grade astrocytoma. अभी तक हम 2 ग्लायल ट्यूमर्स पढ़ चुके हैं बेटा, एस्ट्रोसाइटोमा और ओलिगोडेंड्रोग्लियोमा. एस्ट्रोसाइटोमा के अंदर जो हाई ग्रेड वैरायटी थी उसको हम ग्लायोब्लास्टोमा कह रहे थे. ओलिगोडेंड्रोग्लियोमा के अंदर जो हाई ग्रेड वैरायटी है उसको हम कहते हैं एनाप्लास्टिक ओलिगोडेंड्रोग्लियोमा. ठीक है, इस तरीके से. प्रोग्नोसिस इज़ वेरी मच बेटर. करंट ट्रीटमेंट विथ सर्जरी एंड कीमोथेरापी एंड रेडिएशन. So the average survival rate is 5 to 10 years with this treatment. ठीक है, but if you are suffering from this variety of the oligodendroglioma, which is a little bit more dangerous variety because it's a high grade tumor, so in this case the prognosis is worse, and the progression from low grade to high grade lesion occurs in 6 years, right? So you can actually develop the high grade tumor from the low grade variety which was discussed previously. So this is all about beta the oligodendroglioma. I hope it is clear to you. We will now be talking about another glial tumor, that is the ependymoma.